Hello and welcome to the Be Well or Die podcast. I'm your host, Dr. Silvio Cozzetto, and today we're sitting here with Nurse Ashley. How are you, Nurse Ashley?
I'm good. How are you today?
I am spectacular. What are we talking about today?
Magnesium and all of its beautiful benefits.
Sounds boring.
But it's so good for you.
Magnesium is phenomenal. As a matter of fact, it's one of the go-to things that I tell my patients, and it's one of the go-to things you use on your patients. So
Facts.
Let's talk about magnesium. One of the things we can talk about would be the effects of magnesium on ADHD. Do you know anything about it?
Well, ADHD and magnesium. So we're thinking about how we can kind of relax people, how to calm them down. So when you include magnesium-rich foods or a magnesium supplement in both children and adults that have ADHD, you can help with decreased societal issues, help them learn easier. There's just a sense of calm that can help surround them. So, and relaxation. So if they're, anxious during social situations or any issues of that nature, magnesium can really help them out to be able to stay in their lane and also feel comfortable around others.
And it should also be paired with vitamin D in a lot of cases, especially us Michiganders. We know how vitamin D levels can drop significantly. So magnesium for ADHD, it's not a hugely researched area in the medical field. People in the medical field, no offense, don't get on my shit for this, but they really like the Adderalls and the other focusing drugs, which actually, have their benefits in some ways. But let's start with the non-invasive before we go into the invasive.
Yeah, why not?
What about sleep?
Helps with regulating your sleep cycle. Helps with, if you're that person that gets muscle cramps in the middle of the night that wakes you up and then you're stuck rubbing your calves for 2 hours instead of sleeping, then magnesium can really help with that before bed and just help overall relax you before you go to bed. All us overthinkers who are thinking about everything we need to do that next day, that next week, that next year for Silvio. Those are the people that should be taking magnesium at night before bedtime.
Well, it does decrease cortisol levels, and it does increase a hormone called melatonin, which a lot of people take. And the problem with taking, side note, melatonin is when you take melatonin, you decrease your body's ability to produce melatonin. So supplementing with magnesium actually helps your body regulate its own melatonin, and that's one of the reasons why we fall asleep on magnesium. Just to add to that, if you don't mind.
No, absolutely. Now, that's not to say if you come in and get an IV with magnesium, you're going to be knocked out for the rest of the day. But it can make you feel a little bit loose, a little bit more relaxed, maybe ready for bed if that was what your plan was. Now, it's not going to say that you then have to take coffee and Adderall in order to get through the rest of the day.
What about with the impact, like you said, on cramping? I know that potassium and magnesium together will definitely help, especially with women or athletes, women that are pregnant and men and women that are athletes. It definitely helps with the nighttime cramping, like you stated, as well as leg cramps during the day.
Absolutely.
So what do you find your best form of magnesium to be?
So here at Be Well, we give magnesium chloride and we give it IV. That's not something that we can give intramuscularly, but I have clients that'll come in with tension headaches. Silvio will send me over clients from chiropractic work that have really tense shoulders, really tense muscles, and they get some hydration with me. They get a magnesium IV, and they are walking out feeling a lot less tension. I've literally had, this is probably my favorite story to tell people. A girl had a 10-day migraine. 10 days, she took her pills, she did everything that the doctors prescribed for her, and she just could not get rid of this migraine. She got a Myers cocktail with me, which has a good amount of magnesium in it, and the migraine went away during the IV, which is just like amazing.
Isn't it kind of, it's like fucking wild to me that people will go straight for the invasive when they can do something as simple as a vitamin.
I know. I think that that's kind of what we're taught, even us medical professionals that go to med school, that go to nursing school, all of that, we're taught about drugs, how to fix things after they're already a problem. And I think at Be Well, we're trying to inform people of how to prevent those issues or how to do it more naturally, so that way they're not stuck taking a bunch of drugs and pharmaceuticals for the rest of their life. Instead, they're preventing these things from happening in the first place.
Well, and that leads me to the next point when we talk about natural. So about 60% of the magnesium is produced by the bone, but also the muscles, the soft tissue, and the fluids in your body, including the blood, are another aspect of what produces magnesium. So with that in mind, your diet, your exercise is extremely important. So if you have low magnesium, don't just supplement magnesium.
Right.
Ask yourself, am I smoking? Am I not working out? Am I eating like shit? Like, what am I doing that may be contributing to my body not being able to produce the magnesium? And fix that first. One thing I don't want to do, and I know you're this, I can speak for you on this one, is we don't want to just dupe people coming in to be well.
Right.
We want to make sure that they're living the lifestyle that they should be living, and then supplementing where supplementation needs to be, not just selling you another bullshit
just
dream.
come back to us and we'll fix that too.
Correct.
No. We want you to be healthy all the time. We're just helping to provide different aspects of that throughout your life, not all the time, because that'd be crazy.
Well, right. I mean, listen, if you're depressed, magnesium will help. But if you're depressed because you're on drugs and life is horrible, and you're eating like crap, it's probably not going to help. So
Right. Or it could be like maybe a fix for a day with an IV or a few days, but it's not going to then just relieve you of all of your issues, obviously.
Oh, for sure. I mean, we have young ladies that come in with PMS and migraine symptoms, anxiety and sleep, and look what it does for them.
It definitely helps. And I think that our goal is to get you in a spot where then you can then help yourself too. You continue maintenance, you continue your chiropractic care, you continue your IV therapy, but not to where you have to come in because you need it, but you're
Correct.
coming in consistently so that way you don't feel like you ever need anything. And I think that's awesome.
And to anyone that disagrees, you're talking to two different people that have dedicated their lives to this. So either we're the dumbest morons in the world, or we might actually know something.
Maybe like just like a tidbit at
Just
least.
a little dumb, but we do know something. So is that basically everything you have on magnesium for now?
Yeah, so if you come in because you're cramping, if you come in because your headache just won't go away, in Michigan especially, we have this constant weather up and down. It was literally 70 degrees on Tuesday and 20 degrees on Wednesday. We're dealing with a lot here. And so obviously your body's not going to be able to adjust to that super well, but we can help you out and we can make sure that, you are putting yourself in a position to continue your lifestyle, to continue to perform whatever you need to do, whether it's taking care of your kids, going to work, not spending 3 days in bed because Michigan's weather kind of sucks sometimes.
That's actually a good point. If you're running your own business and you are the product, 3 days off because of a migraine is much more costly than the price of a IV.
100%. And also, most jobs don't give people sick days these days. You know what I mean?
Correct.
Unfortunately, that's where we're at right now. So we're here to help you feel better so you don't have to take those sick days. Or you take them for something fun instead.
There you have it with Nurse Ashley. Come to Be Well, invest in your health, invest in yourself. We got what it takes. And we have the knowledge. We're not just some people off the streets that decided to open up an IV clinic. We actually have the education in it. And we love what we do. Or we're dumb, like we stated earlier.
Also possible, but come see anyway.
Thank you very much. You know where to find us. BeWellLifestyleCenters.com, 792-6570. Office in Berkeley, office in Birmingham, and more to come.
See you guys later.
Thank you.